Good evening. We begin tonight with a growing concern on the healthcare front about the future of end-of-life care, a relatively new specialty, and as a large portion of the baby boomer population now approaches 80, the demand is increasing for services that provide comfort to patients. Our Shira Matsuzawa is here. She reports on how hospice care providers are trying to address the concerns of another aspect of Idaho's physician shortage.
Mark, right now the Treasure Valley Hospice says the demand for palliative care is going up, and studies show without a boost for palliative care education and training, there will only be one palliative physician for every 26,000 seriously ill patients by 2030. Now that's a sobering statistic, and it's not too far down the road. When it comes to hospice and palliative services, the focus is on care, not cures. But as the nation faces a doctor shortage, those services could potentially be threatened.
But one of our fears really is not only that there's not enough physicians, but they're not qualified and educated in the topics of hospice and palliative care.
Honey Goodman is the co-owner of the Treasure Valley Hospice.
What we're seeing now already is that the baby boomers are aging, and as they go through the healthcare continuum, there's not enough physicians and educated physicians in order to take care of them.
Which is why she is now working with the National Hospice and Palliative Care Organization to introduce a bill that would train and educate more physicians in these specialized areas.
There's one thing in medicine that we all have in common, that eventually, because we're human, we die. And to have physicians not trained up in the one thing that all humans have in common is a real downfall.
For me, it's really critical that doctors be educated on palliative care and hospice care.
Brian Martin is the Associate Professor of Pathology at the Idaho College of Osteopathic Medicine, the only medical school in Idaho. For unknown reasons, he says medical students don't typically get a lot of training when it comes to hospice care, and that's why ICOM provides it early in the education process.
The whole premise of osteopathic medical education is to treat the whole patient, not just the disease. So for students to understand exactly what the patients are going through and the support they need to live a good life, and if that means having a good death as well, that's really important for their education.
We've been in a world right now where physicians focus so much on symptom management. Like you said, like you have a cough, we fix that. I have sore body, we fix that. But when you're terminally ill, there's not always a fix to that. You want somebody to walk you through what does quality of life look like to you? How do we make sure you live well until you take your last breath? And for some people, that might be seeking treatments. For other people, that might not be seeking treatments. But a physician needs to know the difference.
Now you heard Honey Goodman mention that bill. She says as of right now, 3 out of 4 members of Idaho's congressional delegation have co-sponsored it, with the exception of Russ Fulcher. Now there are 7 co-sponsors. They are 7 co-sponsors away from having it moved to the next step. And if the bill does pass, it will not only train physicians and nurses, but also social workers as well as chaplains. Mark?
Keep a close eye on that, Shira. Thanks.